When's an ankle sprain not an ankle sprain? Well, when it's a high ankle sprain. Hi, I'm Andrew Darcy. I'm a sports physio from Adelaide, South Australia, and today we're going to talk about high ankle sprains. So, what is a high ankle sprain? Well, if you follow sport at all, I'm sure you've heard from time to time sports commentators referring to a high ankle sprain on athletes. And you might have actually heard that they take longer to heal than a standard ankle sprain. But what exactly is a high ankle sprain and why do they take so long to heal? Well, a high ankle sprain is what is technically known as a syndesomotic ankle sprain. So we think high ankle sprain is actually a lot better term to use because it's a lot easier to remember. The ankle joint is formed by four main bones. There's two shin bones, the tibia and the fibula, and they join at the bottom to form an arch, which holds the talus bone. The talus sits squarely within this archway, and the archway is called the ankle mortise, and it allows the movement of the archway so the foot goes up and down. Underneath the talus is the subtalar joint, and this is where the other main ankle bone, the calcaneus, attaches to the talus. Movement of this joint allows inwards and outwards movement of the ankle, and is the joint that is most relevant in an ankle sprain in general. The majority of these ankle sprains occur when the ankle twists inwards and the ligaments on the outside of the foot get overstretched. And there's usually some pain and swelling to some degree, depending on the severity of the damage. These injuries take anywhere from 1 to 6 weeks to get over, depending on their severity. And as I said, it's the most common injury that we see. Another ankle injury that occurs is the medial ligament injury, where the foot rolls outwards, stretching the ligaments on the inside of the ankle. The recovery from this is usually a little bit longer than a lateral ankle sprain, but it's anywhere in that 2 to 6 week vicinity. A high ankle sprain occurs most commonly when the ankle is forced outwards into what we call external rotation. This forces the square-shaped talus bone to rotate outwards, forcing the fibula to want to separate from the tibia. The ligaments that connect these two bones together, the anterior and posterior inferior tibiofibular ligaments, it's quite a mouthful, but that's the actual name of the ligaments, are overstretched. And if either or both of these ligaments are torn, then the strong union between these two shin bones is damaged and can lead to pain with weight bearing when someone's body weight wants to try and separate these two bones apart. People who suffer this injury often are tended a touch higher up on the ankle than a traditional ankle sprain. And if you look at the anatomy on the images, you can see why, because these ligaments are keeping the two shin bones together and they sit an inch or two above the lateral ligaments of the ankle. This is why the injury takes so long to get over. You need these ligaments to be nice and strong before you can actually take too much weight through that foot. So the management of this injury varies depending on the severity. It's recommended that the patients go into crutches straight away to try and reduce the amount of weight bearing going through these torn ligaments. And we need to stay on the crutches probably until it's pain-free to weight bear, and this can take anywhere from 1 to 3 weeks. They may also need to go into a cam walker, or commonly known as a moon boot, to allow the ligaments to be held together and so that they can heal. And this can be up to a period of 6 weeks. So the rehab starts as soon as the patient can weight bear, really, and involves managing the swelling, restoring normal strength and proprioception, or what we know as balance, and then planning a structured return to sports program once all those attributes of the ankle have been restored. Rarely, the injury is so severe that the anterior and the posterior ligaments are both disrupted and the shin bones significantly widen with weight bearing. Now, this requires that the two bones are held together with a surgical screw for about 12 weeks so that they can heal. And then the screws are removed, and thereafter you're allowed to return to sport gradually over a period of maybe 4 to 6 weeks. So it's quite a significant injury when both of these ligaments are involved. So in summary, it's important to recognise the possibility of a high ankle sprain in athletes, as the management of them differs significantly to a standard ankle sprain, and the recovery is a lot slower. If you've hurt your own ankle, it's very important that you have it assessed as soon as possible by a sports physiotherapist. At Leading Edge Physical Therapy, we actually see this injury a lot more than we'd like. We can help you recover from it, or at least identify if it needs to get another opinion by one of our network of sports physicians or orthopaedic surgeons. So jump on the website down the bottom where you can book an appointment online, or you can go to our Contact Us page and find our phone numbers. And so you can see one of our team and get it checked out.